Nicola. Oh, yes, she's here. Susie's here. Wonderful. Oh, look at that. Just like magic. I didn't even have to say your name, Susie. Perfect. So the next session, everyone, it's quite quick today. It's sort of on to the next. We have Nicola Fitzpatrick and Susie Andrews that are going to talk to us about the lower limb wound pathway. They'll go more into detail about that. We'll probably do the same as we did before, Nicola, where we use the chat box, but we'll kind of, if you need us to help, just give us a shout. And over to you guys.
Thank you very much. Just give me one moment to make sure I've got the slides in the right spot. And if someone can give me a thumbs up if you can hear me okay.
Can hear you perfectly.
Excellent. This is all going too well. What could go wrong, hey? Okay. Do a quick
That's
share.
it. We're doomed now.
I know. Oh dear. Right. Okay. Let's see if I'm sharing even the right screen because I can no longer see you. Susie, give me a wave if you can see the right thing.
Yeah, you just need to click on the full presentation
no
mode.
Thank you. There we go. Right, I'm now blind
Perfect.
to you all. I can't see anything of you. So anything could be going on in the background as we speak. So obviously, yeah, I kind of just stepped in on the end of your last meeting. So now for something completely different. So really what we wanted to talk to you today about was a change that's currently underway and being launched primarily out in the community because obviously this has been worked with the TBNs, but actually it's very, very relevant to you all. So now, what I don't know, and maybe I'll let Susie keep an eye on the chat box, whether you've received a copy yet of your lower limb wound pathway via email. So if you haven't, just put a little comment in the box and we will go back and have a look a bit later. But the key thing, obviously, just to kind of set that scene, because we've kind of changed subject matter rather quickly here, is we all know that compression is the cornerstone of what we are doing for our patients with venous leg ulcers and lymphatic disease. It is absolutely vital. And actually, we've been doing it and it's been tried and tested for many years. So, you know, we know it works. We've got lots of evidence. And at the current time, excuse me, we have options now. I mean, I've been a nurse for, well, this will be 26 years this year. And when I started out, we just had bandages and we used to use 4-layer actually all the time. And over time, hosiery kits and wrap systems have come into play and they've given us a much bigger toolkit to work with, which is a good thing. Because our time is very pressured and bandaging is very time consuming, but actually we can achieve the same levels of compression with hosiery kits and adjustable wraps. And I've just shared there a brief slide which just gives you some ideas of things to consider, because I don't think, and I'm sure you'll agree, as a nurse, one size does not fit all. We really have to take on board individuals, situations, and actually clinical appearance and what we want to achieve and what they want to achieve. So why a lower limb pathway? Well, there's been one actually in Northampton for quite some time, but as I'm sure most of you are aware, with the best practice statement being second edition coming out end of last year in 2022, more than ever, we've got additions to make to the pathway, bringing in much more evidence. So hopefully you've all had a chance to see the best practice statements and have it tattooed inside your eyelids and on the bedside table, ready to reach out and read. It's available to download free as a PDF. And in fact, if any of you ever catch Susie or I, we're often carrying paper copies of it as well, if that's sort of what you prefer. So what we're about to deliver to you today is not something that Eleanor have gone, it'd be really nice, let's just go for it, let's make up a pathway. It is based on the Atkin and Ticklen model, so evidence-based, and that's really, really helpful to us because that means what we're trying to do for our patients is the best thing. And the key thing that's really evolving and has come about, and I think particularly in reflection on sort of the COVID situation, is self-care solutions becoming that first line approach. Now, self-care often frightens many people. They say, well, my patient can't self-care. So shared care, it's an umbrella term, so please don't be put off by it, okay? And equally, if your patient cannot be supported, it's actually something that you can still do. So if you haven't seen it, it may be. Oh yeah.
Sorry, Nicola.
Can you read it out to me? Yeah, because I can't see it.
Somebody's got their hand up. If you want to shout out, whoever's got their hand up.
You can pop it into the chat box. That would be great.
Brilliant. I say I can't see you, so hold that thought if you can. Type it down, and we'll come back to it. Is that okay?
Yeah.
Yeah, cool. So in front of you, I'm hoping you can see the pathway. It might be a little bit difficult depending on the screen you're on, but obviously we will make sure that that gets emailed out to everybody. So what I'm going to do is I'm going to break this pathway down and quite simply walk you through it so you can see what solutions are being recommended as available to you. So the first part of the pathway looks at immediate care, and I think this is really, really exciting because for many, although the concept has been around for a little while, this really gives that permission to do some first aid, because there's nothing worse as someone turns up in practice and they've got a wound and they get a plaster, fancy one maybe, but actually there's more we can do. We've got a great first aid response now. So the first thing obviously we need to do is to bear in mind our national wound care strategy, which is identifying those red flags and also getting that assessment done in a timely fashion. And I appreciate that is not always easy, particularly with the availability of Doppler and skilled staff. Now, today, because of the time, I'm not going to focus very heavily on red flags, but it is something we can direct you to for more information later if you wish to delve into it. But you probably just see them on your screen there now. We will delve into it if you need to at a later date. Obviously, we need to, when that person presents to us, we need to prepare their skin, we need to apply a suitably absorbent dressing, but we can now deliver mild graduated compression. But just be aware that that mild graduated compression may not be your ultimate solution for the individual. And I tend to sort of give the analogy in this situation, just as if, let's call him Alfred. Alfred has a fall and he breaks his hip and he gets taken to hospital in an ambulance. Now that stretcher that he's put on, that trolley, isn't going to have great pressure relieving for him, for his condition and his needs. But the first aid is to get him to hospital. So in this case, our immediate care is that first aid moment. So it's not going to be perfect, but we now have the evidence that says it is the right thing to do. We need to make a start. It's not okay just to send someone home with a plaster. So what are our options? Well, the pathway gives you options. So hopefully all of you are familiar. Now, obviously in this call, I'm not going to be able to show you the products because it's a bit tricky waving them around in front of the camera. But I think many of you are very experienced with these items. So a very simple way to deliver up to and including 20 millimeters of mercury is actually with the liners, the active aligners. So each liner delivers up to 10. So one on top of the other gives you your up to 20. And if anyone's familiar with the liners, they're lovely and slippery and slidey. So they're really easy to get on. And this can be a really nice way to introduce an individual into helping themselves, because actually the liners are not totally dissimilar to putting on socks, hosiery of the normal kind. It really is quite straightforward. So that's one option, and we do them in a pack of 3. So if you can imagine one over the wound, one over the top, you've got one spare. That evening, as you would change your socks, take the top one down to the bottom layer and apply the next one and keep going, so that you've got a sort of clean range, if that makes sense. You can also, if you know in your heart of hearts that you're going to be going down a hosiery kit option, you could take the liners out of your kit and start using those if you can trust your patient to keep hold of the outer piece. That's something obviously to decide based on the individual. The other option is actually the British Standard Class 1 Activa, because that delivers 14 to 17 millimeters of mercury, so it's nicely in the range of up to and including 20. And there's lots of options available to you there, from socks to a more traditional hosiery and colours, etc. And that's fantastic, because over that dressing you are already getting them into the mode, into the understanding of compression. Now I'm just going to go backwards again, because there is on the pathway, I don't know whether you can see it, you have a little tiny box in the corner, which has, if the patient has considerable limb distortion or exudate and is not suitable for hosiery, then you can apply K2 reduced. So I just want to sort of clear up the elephant in the room, so to speak, because yes, no, I don't work for Ergo. All right, but it's really important to understand why this is here. So K2 reduced, if you actually take the little leaflet out of the box, it delivers around 20, so it actually does go slightly beyond. It's really important to understand that reduced compression is not the same as mild. The classifications don't marry up. Reduced compression covers the mild and the moderate part of the scale. So, but it was discussed amongst the TVNs, and it was felt in those situations, and I'm sure you've had it, perhaps someone comes in with a carrier bag over their leg because it's leaking so badly, the situation has got horrific, that actually something needs to be done rather drastically, then that bandage is available if they are deemed as safe to do so. But obviously please bear in mind you are taking them over 20 millimeters of mercury potentially. All right, but you have weighed up that risk. It is also deemed that actually the assessment will therefore be triaged as a high priority, so that actually you will only be changing that K2 reduced bandage once or twice, because you are going to get on with that Doppler as a matter of emergency. All right, so but it has been recognised that TVNs feel that it's important to have an option there. So I'm just going to dive forward again, please excuse. So assessment stage. I'm not going to drill into this, because this is primarily looking at the Doppler phase and where patients' ABPIs land to continue with their treatments. Okay, so we're going to jump on to that ongoing treatment, and this is where it kind of gets a bit more nitty-gritty. So we have different options, and some of this you will hopefully already have been embracing, and hopefully some of what I might say might help kind of clarify where we're at. Obviously, as I remember you make me saying, historically used to bandage absolutely everything. That's what we did, but actually bandaging is no longer first line, and your pathway backs that up. So the first thing, bandages. So on the pathway, you have two types of bandage. You have got the Ergo K2 and you have got Actico. It is not that one is first line over the other, they are used in different scenarios. So the first thing to bandage, the criteria, they have got exudate that you cannot control within the padding. So you could have a lot of exudate, that doesn't mean you need to go into bandage. If it's under control, you can use your other options of a kit or a wrap system. So that's really important. Bandages, it's not about the size of the wounds, okay? Because hosiery kits, it's not about the size. If it's a big wound, that doesn't mean it needs a bandage. So bandaging is based on the exudate being under control with the topical dressing, and whether you have got large amounts of reducible edema and a misshapen limb. So you don't need me to tell you what the advantages and disadvantages are of a bandage. I mean, for me as a patient, the disadvantage would be the fact I'd be having a festival wash, and that would be hugely impactful for me. It can actually also be that it can actually affect mobility further, because they can be quite bulky bandages. So that can be problematic. But of course, we do know for reshaping and for really high levels of exudate that actually changing bandages frequently is in the patient's best interest. And obviously reshaping that leg so that we can then deliver graduated compression more effectively. So you have your two options. So K2, ankle circumference 18 to 32. Above 32 is Actico. That is really important to understand. It is not either or, there is a differential. So firstly, in order to select a bandage, Is the exudate controlled within the topical dressing? Do I have large reducible edema? Is the limb distorted? And then you need to know the size. And that is really, really important to understand. So obviously, what's really important as well is what this is hopefully telling you. If you know your Actico bandaging, nobody should be in a single layer of Actico anymore, because as you probably know, 18 to 25 after padding is 1 layer of Actico and 2 layers of Actico if it's above 25. So don't forget, that is important to know. We as a company, Actico is not a reduced bandaging system. We look at therapeutic strong compression at all times. There we go. And in line with best practice, once your symptoms are under control, and this is very important, you can actually then transfer to your hosiery kit or your wrap system. So it's really, if you start your therapeutic compression in a bandage, it doesn't mean you have to finish. So as we know, our reducible edema, our limb shaping and our exudate, as that inflammatory response responds to the compression, actually it could only be a couple of weeks that the individual has to remain with a bandage system, and then they can move into something else to carry on their healing. It's not expected that they will go through perhaps 6 weeks or more in a bandage. Important to bear in mind, and that's really important as well for your patient to understand, because yeah, if it's their first time, it's quite a big thing to be bandaged. Just to get it a little bit more practical here, we've got some legs going on, and hopefully you can see from the sort of sublime to the ridiculous in a way, but something you see a lot of. So obviously on the left hand side you have a very nice leg shaped leg. Obviously you have a wound there. And then as you obviously go towards the right hand side, you can then see some really gross edema, misshapening, folds. So on your severe side, you will be looking at your bandaging. But obviously on the milder side, you'll be looking at hosiery kits and ready wrap. They do not require bandaging, those the other side of the line. And in fact, the one just past the line, so the second from the right, it's not far away from being ready actually for a wrap. Just a little bit of creasing going on there around the ankle area that I'd probably like to deal with first, but actually they're well on their way. So just to bear in mind on a visual of those patients. But do notice, if you perhaps look at the middle picture, which would be suitable for a wrap or a hosiery kit, it's quite a big wound there, but that's absolutely fine. Now, also really important at this point to sort of address the often reduced systems get used for many individuals whose assessment doesn't actually rule out full strong compression. And it's really important that we guide our conversations with our patients to explaining that actually if we use reduced, we aren't driving them towards healing. It's a hard conversation, but I think it's really important, be it because, you know, if you aren't delivering strong compression where possible, you aren't actually doing it right. You're not doing best practice, and that's something from your own perspective it's hard. But also strong conversations with patients matter. So I know for sort of my day with patients, one of the things we used to talk about when someone's like, I don't like it, I can't tolerate it, we would perhaps reflect on a knee replacement that the individual had, and we talk about those first few days post-surgery when, my goodness, you know, you come around for the anaesthetic, it's uncomfortable even with pain relief, and the physio gets you moving, and it's tough. Those early days are tough, but it didn't stop the patient going to hospital to have the knee replacement. And I think sometimes we need to address how we talk to people and explain the good of what we need to do, but actually it's not forever. It's for a brief period of time whilst we get the inflammation under control and we drive them towards healing and limb reduction. So I think sometimes we take for granted that even though we're in the community and primary care, what we're doing is really, really important. Just because it doesn't require a general anaesthetic and hospitalisation. Don't downplay what you're doing. So let me just jump to the next slide. So as you're aware, first line is now, and obviously best practice statement, is your hosiery kit. And I think something, in fact, it might be able to answer a little bit more, and it is we hadn't realised that on POS, obviously your ordering system, does have hosiery available now for the community, but I think it might be tucked away from you, which we hadn't realised for you in the practices. I don't know whether anyone can confirm that. Perhaps on the chat box, Susie, can you see it all? Because obviously this is making life a little bit difficult, and it's something that perhaps we need to understand so that we can perhaps make things more available. Can you currently get a hold of hosiery kits on your on-POS system?
Sorry, they're currently talking about Ready Wrap and the issues that they're getting hold of Ready
Okay.
Wraps.
Yeah,
which we
sure.
will cover in a minute,
We'll
everybody.
come into, yeah. But hosiery, can we get hold of hosiery easily? Because obviously with
They're
hosiery
saying
being
no.
right, okay. No, that's good. It helps us to understand the situation, because obviously here we are saying we want to be able to deliver immediate care in that moment, and if we haven't got the things at our
Nothing's on
fingertips.
on-POS.
Yeah, right, okay.
They're saying prescription only, not on-POS.
Okay, that's cool. Okay, we will have a chat, won't we, Susie? See what we can do.
We will.
Because we want you to be able to deliver immediate care. I mean, I think, you know, if you present at your surgery with an ulcer, you kind of need some first aid done. You need things available. Just as on that Doppler assessment, you need to be able to get on with their care, because to me it would be like, I don't know, taking my child to A&E. They X-ray his fractured wrist, but they can't do anything with it. It wouldn't be right. So this is something we do need to address for you to try and help the usage. I think one of the most important things to me for the hosiery kit is that actually out of all of these systems, short of putting it on the patient's head, you can't get it wrong. So every single time you are delivering strong compression. Where with bandaging, it's only as good as the person that applies it, and obviously how often you see the patient, because obviously if their edema is reducing, it can start to slide very, very quickly as they're perhaps using the bathroom quite a lot and getting rid of all that edema that you're squeezing out of them. So actually your hosiery kit is one of your safest because it's reliable. It does what it says. So hosiery kits, let's keep going on a little bit. Let me just give you a bit more here. One of the things, if you have started your patient out using the liners, they do need to be aware that they won't need 2 liners under the outer piece of their hosiery kit. That'd be very strong compression, it'd be fabulous. But we don't do that in this country, that's more European to go to very strong. So they would need a liner and an outer layer, and there's lots of different colour options available. So that's something to be aware of. Also the liners you can get in open or closed toe. Also something really important, because I know in some of the areas I work culturally, some of my Indian patients, the ladies like to have their toes exposed. It's usual to wear a sandal. So actually having some open toe, really important, helps compliance, makes people feel more comfortable. So hosiery kits. The reason I put this slide in, although I don't want to get too bogged down, but I think it's really important to bring to mind, because if you look at the healing rates between a 4-layer bandage and a hosiery kit, and obviously it's part of the old Venus 4 trial, you will see, obviously, there's not a huge amount of difference. But what I want people to really, really take on board, if individuals start their journey in hosiery, so immediate care, they are less likely to reoccur if they have been in hosiery. Where if they go into bandaging, it tends to give this bit of a mindset that once I'm healed, I am done approach. Where if you train from the start your individual with hosiery, this is obviously old data that it reduced recurrence rate by almost 10% there. I suspect it would probably be greater now. And obviously the annual cost is also much reduced. So really important things to take on board when making your decisions. And I just got a little image here, which hopefully will be helpful, because I know sometimes our packaging initially looks the same, but it's important to know the difference. So Activa is your hosiery kit British standard, and it's for those without edema. And then our ActiLymp, so think lymphedema, are for those who have had a history of edema. Okay, so just so you know which one to pick, and obviously so many different colours and things to choose from. Right. So wraps. Now I know there's obviously a discussion that they're really hard to get hold of, but where do they sit in all of this? Well, we've we've already said we've got our hosiery kit actually, which is our go-to. It's our first line, and that's obviously a leg that it might have edema, but there's no obvious huge amounts of reducible edema, misshapening, and the exudate is under control. Our bandaging, we know, is based on, the two options are based on the size of the limb. Now, obviously, one of the other things I would raise, obviously, Ergo K2 is suitable for those between 18 and 32 centimetres at the ankle. Now, I would raise the point that if somebody had an 18 centimetre ankle circumference, that doesn't suggest they've got huge amounts of reducible edema, because that's smaller than my wrist. So just to have that in your mind, you know, should I actually be bandaging this person? Keep on that. So, where does wrap sit? Well, I feel wrap kind of sits in between the hosiery kit and the bandaging systems, because actually with the wrap system, you've still got some play to get that edema down, because you can bring those straps in. I have to be honest, I do like the wrap system. I like it because individuals who find getting down to leg level, foot level quite challenging with hosiery, this can be a lot easier. And what I really like about it is it absolutely mimics Actico short stretch. So the wrap system is suitable for people who suffer from chronic edema, because you are mimicking a 50% overlap. You are mimicking how you work your way up the leg. And I will just draw your attention here. I don't know, and maybe just a quick kind of yes or no. We have recently introduced a different foot piece for our wrap system. It's quite small, I'm afraid, on screen for you to see if you haven't seen one, but you can see these tiny little holes here. And this is just brilliant, because what this means is the individual can hook their fingers in it if they've got a bit of arthritis, rheumatoid, to bring it around their foot. Bit tricky to see if you haven't seen one up close and personal, but it's known as the foot CT because it conforms to the limb. So a huge improvement on the previous foot piece. So it's not wrong if anyone's got the current foot piece, but as they replace things, it's now the foot CT. So really nice bit of kit. Susie, can you see if anyone's seen that in the answer box at all? Or whether it's something people haven't yet explored, the foot CT. Is it something people have seen?
Oh, yeah, quite a few of them have seen it.
Brilliant, excellent. As I say, it's slowly kind of filtering into the supplies. Yeah, excellent. So, as I say, the compression wrap, I think, gives people a lot of options. The other thing, and it might seem minor, but particularly for you, because patients come to you in your practice, so they're out there, they're seen in public, but actually you can get a wrap, not necessarily in beige, you can get it in black, which doesn't say leg ulcer, it can say squash court injury, which to many people feel an awful lot better than perhaps the bandaging or something really obvious that says, you know, what's going on with their leg. So something quite important. Also, the new foot CT, I get very excited about. I get to try it on a lot when I'm demonstrating. I can get my normal ballet pumps on with it. It doesn't give you a huge bulk around the foot, so really nice, and it works really well. So you can't see me, thank goodness, but you have to believe me, I'm quite small, but my ankles are quite big compared to my foot size. So unlike our old one that perhaps made the assumption the bigger the ankle, the bigger the foot, this one comes in different foot lengths, so you have much more flexibility. And when you wrap it, you have much more in the strap, so you can shape appropriately. So actually, your compression wrap system is rather nice because it gives you a bit more to play with. So actually, there can still be that reducible edema, and you can keep bringing things in. And obviously you can see there by the slide, we've got obviously the advantage of the hosiery kit is that low profile, nice silky liners, but obviously you've also got with your wrap system, should you still have a slightly unusually shaped limb, so perhaps the champagne calf that's really big, you can actually use an extender strap to take out and give you another 10 centimetres on the wrap that you've got available to you. So actually it's got huge amounts of use. For, as I say, most of our patients, unfortunately, their legs aren't standard. Also, obviously, really important is the life of your hosiery kits and your compression wraps. We tend to obviously go down the one in the wash option. So you've got 6 months basically with that supply, and that's quite reasonable when you think cost-wise compared to changing bandages every few days. Because if you are bandaging a limb, if you are changing that bandage, I know the box says you can change it every 7 days, but actually, if it's got exudate that I can't control, and it's a limb which I'm reducing the edema, and it's a strange shape, 7 days, it's going to have filled back up and reshaped into something else. It's all going to have slid off. So actually, if you haven't got the time to commit to bandaging, don't do it, and think really carefully about why. And here's some great options going on here. So just to kind of summarize, in fact, Susie and I have got little flyers on this because people find this quite helpful. This little table here is a nice way of kind of marrying up social factors, so things that matter to your patient, with the exudate control, okay, that's going on, because all of the systems we've mentioned deliver strong therapeutic compression, so can heal legs. So, but you've got a choice, and I think that is a wonderful thing. So if individuals would like copies of that particular slide, please obviously let us know at the end, and we'll get that over to you, no problem at all. So obviously we know that once we've healed, we are looking at a life of compression hosiery, but actually, as much as this is at the end because this is the way it flows, and it's about healing and it's about their long-term care, this has started way back at the top, because unless they have a wound or chronic edema on both legs, the other leg has already started its journey in compression hosiery and that long-term commitment. So really important to bear that in mind. I say we've got it here we go. Unfortunately, for many patients, they get reoccurrence rates are quite high, 69%, but it's really important that we start training them really early on about the importance of getting that hosiery on. So if we start it right at the beginning, not just on the affected leg, but on the other leg, it's not just an end point. It's the whole way through. And of course, in the practice, you're seeing people and you're needing to do your reminders and making sure they get their hosiery replaced. I've just got a quick slide here, just as a quick reminder. I don't know whether I'm waving my mouse over, I don't know whether you can see it. Just a reminder that when selecting hosiery for individuals for maintenance, please remember to use your cross-checker so you actually get the right level of compression on your patient. So for example, if they have a healed ulcer, it actually lands them into this amber section here. So actually they need to be in 2 or 3, class 2 or 3. And if they've had chronic edema or wet leg, they're actually down in the red zone here. So again, they need really good compression, so 2 or 3. So we often see quite a lot of patients who come out of strong compression, and then they get put in a British Standard class 1, which is right up here. Then you get them coming back with this sort of like, oh, what's in the hosiery? Is it an allergic reaction? Of course, it's varicose eczema, because they've jumped to too low a level of compression. So just to give you a quick reminder here, British Standard class 1, which obviously you can use for immediate care and obviously very mild cases, but actually you wouldn't be seeing that on someone with a healed leg ulcer. If you look at European compared to, the reason we don't use European class 1 for immediate care is it goes beyond that 20 threshold. Okay, but if you look at how they marry up, now remembering your British Standard is for your without edema, if they've ever had edema, European. So they may not be in front of you now with an edematous leg, but if they've had edema, then they should be in European. But hopefully, because you started them off very early with hosiery, that actually they're getting better at putting it on. The struggle is getting less, because it isn't easy, but we've got options to how we can support that. I just set a little marker there just to remind you that actually a European class 1 is actually a British Standard class 2 equivalent, a much closer equivalent. So just a quick kind of bring it all together. So in the sort of community, we've launched obviously this pathway to support practice, because unfortunately, and I say there is no finger pointing going on here, but it's very much recognised that nationally there's huge variations in care, and it's not unusual that that should happen, because of course a patient won't see the same nurse at every single appointment. So using the pathway helps to keep everybody on track, on target, constantly assessing, am I doing the right thing? Are we going in the right direction? And it's evidence-based, which is what you need behind what you are doing for your patient. So I'm just very briefly going to hand over to Susie, who's just going to chat to you about some resources that we can make available to you to try and help you. So over to you,
Nicola,
Susie.
just before you do, if you pop back 2 seconds,
yeah,
it's come up a couple of times. So people just want clarification that liners and class 1s don't need an APPI.
they
to
do
be
not. No,
put on patients.
no, absolutely. So basically, your immediate care is having ruled out those red flags, and you are anticipated to be doing a full assessment, which includes the Doppler within 2 weeks. But it's that stage before. So if you've ruled out the red flags, you can put under and up to and including 20 millimeters of mercury, and that is fine. You do not need the Doppler to do that, and that's really the powerful impact of this best practice statement 2022. Is it saying it's okay, we can do that, and I think that's a huge benefit to us all, so we can get in there and get doing something. Is that okay?
Perfect.
Excellent. So over to you, Susie.
Okay, bless you. Thank you, Nicola. So I just wanted to share, as part of the new venous leg ulcer pathway, we've also got new leg ulcer passports. Has anybody used the venous leg ulcer passports before? Because we had them with the original venous leg ulcer pathway pre-COVID. If anyone wants to put in the group chat. Anyway, oh yeah, no. Okay, oh brilliant. So we have got a couple of people that have used them before. Okay, so these are going to be a little bit like your catheter passports, where hopefully if the patient unfortunately goes into hospital, for example, they will be aware that they need to keep either their hosiery kit or ready wrap on, because my own dad is in a ready wrap. He ended up in hospital, unfortunately, for a week and was told to take his ready wrap off. And at the age of 80, he's pretty compliant. So did so, and it actually sent him back 10 weeks. His legs started breaking down and he ended up with cellulitis. So these passports, obviously aid the difference in the communication between primary care and then the acutes, but also it's all about empowering the patient. Obviously they're going down the self-care pathway, which, like Nicola said, in COVID, amazingly, suddenly so many patients were able to self-care. So we're kind of trying to jump on this with the self-care pathway, but also through using the passports, you know, patients will have the opportunity to understand why they've got the venous leg ulcer, how to exercise, and also little snippets and bits and bobs like that, showing and demonstrating how to be able to use ready wrap. So if you would like any of these, Nicola and I have just literally today had some delivered, so please just reach out to us. Our contact details will be at the end of the presentation, and we're more than happy to arrange delivering and dropping these into you at your surgeries. Okay, Nicola, next slide, please. Fabulous. So also, I've noticed in the chat, a lot of people have been asking for this presentation. A lot of the slides that Nicola's presented from are actually from our Learn on Demand. There's a QR code on your screen now. This is totally free and is an absolute brilliant resource of videos. It's like a lot of people use it like a library. You know, when you can't get hold of that one person in the surgery that you think would be able to help you, this gives you access to sort of search things, research things, etc. It's a really useful resource, you know, and definitely worth signing up to, completely free. So the QR code, like I say, is on there. Next slide, please. And then also we've got Club Squeeze In. Has anybody signed up to our Club Squeeze In yet? Or anybody seen it? Okay, just so that you know or have a little bit of knowledge about it, again, there's a QR code to sign up to it. It's a resource which brings together a lot of our popular resources. It's got a Squeeze In patient referral pad, healthy living booklets to support Legs Matter, a cross checker, so aid you obviously choosing the right hosiery for your patient. It's also got ReadyWrap measuring forms and also the envelope. So obviously I noticed a lot in the group chat of people getting or struggling to get hold of ReadyWraps via prescription. I'm not sure what's going on within Northampton, but it seems to be Northampton in particular that people are struggling. So what we're really advocating is either, I noticed somebody said they use day-long envelopes, so we use two companies. We've got day-long envelopes, and then I don't know if you can see these are the new NWAS envelopes, which if you just send an email to either myself or Nicola, we are happy to get some of these sent out to you. And what you literally do is you obviously measure the patient, then write the prescription, and if you then send the measurement form and the prescription in the envelope, that ReadyWrap or hosiery will come back to the patient or to your surgery within 5 to 7 working days. It's a really, really slick service, and it stops. I mean, I read somewhere in the chat that some poor patient had been waiting for 3 months. You know, that's not on, is it? It's not fair on you, and you know, you haven't got the time to chase it up, and it's not fair on the patient. So please, whilst we're trying to discuss and highlight to the tissue viability nurse the problems that you are having out in community, out in primary care, and community are flagging this as well. You know, we'll try and see if we can come to some kind of solution. But in the meantime, there are, like I say, the day-long or Creedon Hill envelopes as well as the NWAS. But yeah, going back to the squeeze in, this is a really, really good resource. And again, it's completely free of charge. I noticed a lot of you have putting like, yes, please to envelopes and stuff. If you can just ping me an email, because I won't have access to this whole chat. And because we're chatting, I have tried to make a note of everybody that's requested everything, but it would just be great if you can ping us an email or a text or whatever, and then we can action it, because I don't want to miss anyone off. Can I have the next slide, please? Fabulous. And then last but not least, has everybody had the opportunity to now use Suprasorb P Sensitive, which has replaced your Alevin on formulary? I know when I've been going around to some of the surgeries, I've had really, really good feedback. Yeah, I can see a lot of people are using it. Hopefully you've had the opportunity to use the heel and the multi-site. Obviously we've got the usual standard sizes, but I also just wanted to make you aware that we've now had it put onto the skin tear pathways, both in the acute, so Northampton General Hospital and Kettering, and then in all the care homes they've now got Suprasorb P on there in trauma wound care boxes. So yeah, so it's just so that it's so good on fragile skin. I'm sure you've all sort of had the opportunity to use it now. I noticed that a lot of people are saying they much prefer it, so this is great. So that's Suprasorb P. Next slide, please.
You're there,
Oh,
my
no,
dear.
so
You are complete. Yeah.
fabulous. So now, is there the next slide where we've got
Oh, it's just our lovely
our
faces.
contact details? Yeah. I'm certainly not photogenic, but those are our contact details. So you've got our email addresses and mobile numbers. So please feel free to reach out to us. I'm in Northampton most days at the moment, so as you can imagine, I'm very busy rolling out the venous leg ulcer pathways in community and in some of the surgeries where you've reached out to me and have asked for some training. So I know Nicola covered an awful lot. Please feel free, if you want some support with ReadyWraps or hosiery kits, etc., or you would like to see the new ReadyWrap for CT, please feel free to contact us. We are more than happy to help. And has anybody got any questions? Wow.
Just looking at the side box.
Shall we use Activa
Low
hosiery?
code again. Hang on. Yeah, okay. Let me just bring up the presentation again with codes. Bear with. Excellent. There
So Lisa's asked, shall we use Activa hosiery? Absolutely. So that is Eleanor's hosiery. So you've got Activa and Actilink. Lisa, are you meaning in terms of immediate care or just in general? Yeah, Sarah will put our contact details up in 2 seconds.
Right, there we go. That's the learn one I noticed in the chat box there. If I go through each one slowly again, it gives everyone a chance to try and grab it.
So yeah, Lisa's just asking about the Activa hosiery. Yeah, so on your formulary and as part of your lower limb wound care pathway, it is either Activa or Actilimp. And hopefully, I think it's been a slight oversight, but within community, they've now got both Activa and Actilimp hosiery and hosiery kits on their on-POS system. So we're just we've got a meeting next week with your tissue viability nurse team, and we're hoping to get it on the primary care on-POS system as well, so that it makes it a lot easier for you guys to access it, because it's just horrifying when you're reading like the, you know, that you're struggling to get a hold of anything. So we're very much wanting to support.
Excellent.
Anybody got else?
Hopefully.
Any other questions?
Oh, there we go. I'll just come out and stop sharing so I can see what's
Where
going
can
on. It's
I
very
get the
unnerving.
measurements? So Lisa again, where can I get the measurement form to send today along with the scripts? Thanks. So that's in our hosiery resource packs. I'm more than happy to get one of those sent out to you. Nicola, can you go through about the ankle circumference?
Sure. Okay.
Again.
Let me just. So
Do's
what I
and
don't know,
don'ts.
sure, absolutely. So ankle circumference, 18 to 32 centimeters is for the Ergo K2, and above 32 is Actico, which of course means it will be 2 layers. So obviously, just to be aware, as I said, if someone's ankle is measuring 18 centimeters, and to be quite honest, mine measures 25 anyway, that's not really hugely edematous or misshapen, so please just bear that in mind, because remember, when you're going to use your bandages, it's for those edemas, really hugely, lots of reducible edema and reshaping that you need to do, so have that very much at the front of your mind. I think just now that I can actually see people again, obviously, hopefully, if you haven't already had them, hang on, I'm a bit blurry there. Let's try and get that in the image. Let me just unblur my screen. I blurred my screen because usually at this point my dogs walk through and start doing things in the background. So, but of course it means you can't see what I'm holding. There we go. So that's obviously the Northampton version of the pathway. But so that you really can see, I don't know whether you are familiar with obviously wound care guidance here, 2022. If you turn to page 8, there is the pathway. So it is not something that L&R have just sort of gone, right, this is what we're doing. You know, I really want you to be aware this is best practice and what's available to you out there. So I do, when I sometimes go around places, carry some of these. So, you know, I'm happy to hand out as needed. I think one of the things I know Susie and I are very keen to do, so please obviously do get in touch, is, you know, if you do want a session where we can get hands-on with a wrap, with the new foot CT, whether it's measuring hosiery, whatever, do please get in contact. We would be happy to help. And I know, Melanie, something we were chatting about was maybe setting up some sort of, you know, drop-in type sessions in the future, if that might be useful, because measuring can be a bit of a minefield and it's not that easy to do in this forum. I think me putting my leg on the desk might be quite entertaining, if nothing else, to try and show you how to measure a leg for hosiery, and I'm probably not going to try that one. So yeah, I do appreciate.
We've got a couple more questions.
Lovely. What have we got going?
More questions.
Here we go.
We have a few patients in 1 layer Actico who need bandages. How would we get them into hosiery or ready wrap if they need a primary dressing and padding?
So really when you say they're in, so when they're in one layer of Actico due to their ankle circumference, yeah? Is that correct? Is that what that says?
It's Sorry. Rachel Johnson. We have a few patients in 1 layer Actico who need bandages. How would we get them into hosiery or wraps if they need a primary dressing and padding?
All dressings can go under a hosiery kit or a wrap system. It does not impact using that. And actually, with a hosiery kit, because the liner is quite loose and stretchy as you put it on, it's not difficult to get it over the top of padding dressings, whatever it is you're using underneath there. Because equally, you know what it's like sometimes when you're trying to bandage, aren't you? You're trying to hold on to everything at the same time as getting your padding on. Actually, the liners are really, really very good at helping this. And obviously with the wrap system, you get a hygiene stock that comes with it, which also helps to hold everything in place. At this point, it was actually something Susie raised with me earlier in the week, just to be aware with the hygiene layer that goes inside the ready wrap, there is no compression on that item. It is different to a liner for a hosiery kit. Okay, just to make that one clear. So with a ready wrap, when you get sent components, you get sent a stock which has no compression. It actually also has no heel on it, so it's a kind of one size fits all. So it's just a hygiene layer, and those the liner, and in the case of the ready wrap, the hygiene layer help to hold everything in place so that you can then put your wrap over the top or your hosiery kit. Is that okay? Anything else? I'm just scrolling, sorry.
Is Craig still on the call?
Oh yes, I'm hopping between this one and the GP PLT. So
Oh, well
yes,
done.
I'm still here.
Oh, bless you. Craig, would it be possible? A lot of people have been asking for a copy of the Venus leg ulcer pathway. I think Nicola shared it with you last week. Would it be possible for you to send it out? Because we don't have for everybody's emails.
Absolutely.
Thank you so much. That would be amazing.
I must have missed that. But yeah, absolutely no problem. What I'll also do is I'll share all of the information. So if you can, the slide deck as well, and I'll put that all up onto our web area and make sure that that's available to everybody to download as well.
Fabulous, thank you. So can we use a hygiene wrap with the liner?
Does the ergo reduced require a yeah, got it, yeah. So basically, if you're using it for immediate care, no, it doesn't. But remember, you're only using it for immediate care under a really, really dire situation. So someone's come into the surgery, their leg is leaking all over the place. It's crazy shape and size. You're going to use it, but you're going to use it only for a few days because you're going to get that Doppler done. If you are using Ergo K2 reduced later on in their care, because their ABPI has stated they're not suitable for strong compression, you will need that Doppler because you need to justify why you're using it in the long term. And obviously, if they have appropriate ABPI between 0.8 and 1.3, they should be in strong compression, because obviously best practice is not a reduced system, because that only covers them from the mild to moderate compression range, which will not heal them. Is that okay?
Yeah.
Right. I think we've left you, Melanie, with 10 minutes, which might give people a quick toilet break maybe before their next session.
I have to be honest, Mel's had to jump out because she's had to jump onto the GP one for a couple of minutes.
Bless her.
Yeah, it's the joys of running 2 sessions side by side. So
multitasking at its best. I'm impressed.
Absolutely. We're quite good at it in this place, I tell you. But thank you so much. That was a really good session. As I said, what we'll do is share everything that we can with everybody, and also to signpost them to the very useful e-learning as well. I think it's a great call to get a comfort break, because we literally did do 1 session straight into the next. So I think people are probably gasping for a coffee at the very least. Our next speaker is due just after 3, so we'll resume again at that point. But thank you so much, and
no problem.
We look forward
to meeting you all soon. All right then. Bye for now.
Excellent.
Bye bye.
Thanks everyone.
Thank you.
Bye.
Bye. Bye.
Excellent. As we mentioned, then what we're going to do is take a short comfort break, and then we'll be right back very, very shortly with our next presentation. But I have to say, so far, what a good PLT this one's been. Really, really informative.